Right, we're going to do another one of the picturing medicine drawings now. This one is on pancreatitis. Show the labels first of all. So this is a visual summary of the various causes of pancreatitis. Often with pancreatitis, the mnemonic "get smashed" is used, and so in a way we've started from there with this diagram. It seems like a sensible place to begin. The only thing about the "get smashed" mnemonic, personally I find that mnemonics, they're helpful to a degree, but I can often find myself getting the various causes confused, and there's no P in the mnemonic, and pregnancy down here is actually a potential cause of pancreatitis, which in a way has been missed off of that mnemonic, but it's still quite helpful to a degree. Anyway, let's go through the various causes together. I'm going to go through the mnemonic, I'm going to remove the labels, and I'm going to do it that way so that hopefully we're focusing very much on the image, because I think it's the image that at the end of the day is going to be what sticks in your mind's eye. So I get smashed. The first one is idiopathic. Down here we've got a question mark. Often we don't find a cause for pancreatitis actually when patients present with it. But more commonly we do, and one of the main causes is the G of I get, which is gallstones here in the middle. You can see we've got a gallstone blocking the common bile duct of this pancreas, as it were. So that's the G, and the E is ethanol or alcohol, which is illustrated down in the bottom right hand corner. Another common cause. Gallstones typically associated with acute pancreatitis, and alcohol with more chronic pancreatitis. And then the T stands for trauma, and trauma has been illustrated by this rather sharp penetrating device which is actually injuring directly the pancreas. So direct injury can lead to pancreatitis. So we've done the I gets, and we're now onto the smashed bit. The S stands for, in particular, steroids, and you can see that this individual is holding, I hope you can see that okay, in his hand various medications, and that's supposed to illustrate, amongst other things, steroids. The M of smashed stands for mumps, which of course is a viral infection which causes infection of the salivary glands, in particular parotids, and that's why I've illustrated here the parotid glands which are inflamed. Just as an aside, mumps causes inflammation of the testicles as well, causing orchitis and sometimes infertility, and it can cause a rash. So we're on to the A, which stands for autoimmune. We've got immunoglobulins coming in here on the right hand side, and that's supposed to prompt us to remember that. What's commonly described is conditions such as vasculitides. Polyarteritis nodosa is one such vasculitis which can sometimes cause pancreatitis, so that's important to be aware of. So we've got SMAS, smashed. We'll come to another S now, and that's scorpion stings, and here you can see a rather onerous scorpion on this poor person's hand, which is aimed at remembering or helping us to remember that. Then we've got H. H stands for a few things. Hyperlipidaemia. Up here you've got raised blood lipid levels, hyperlipidemia, and also hypercalcemia. Up on the right hand side you've got raised blood calcium levels, and also hypothermia. This individual is blue, and the reason is that he's cold. Extremes of cold or hypothermia have been reported as being associated with pancreatitis. And then we've got another E. The next E of smashed stands for ERCP, which is being illustrated here. It stands for endoscopic retrograde cholangiopancreatography, and this device is used diagnostically and sometimes therapeutically to be able to visualize the point where the common bile duct enters into the duodenum, which I've illustrated here. And then finally, D of get smashed refers to other drugs and tablets, and there are a variety of tablets and drugs which can cause pancreatitis, not just steroids but also diuretics, certain HIV medications, certain antiepileptics such as sodium valproate, azathioprine also is associated with pancreatitis, but there are quite a few, and it would be sensible to just review an individual's medication chart if they've got pancreatitis and just consider whether any of them could potentially be the cause. And then finally we've got pregnancy down at the bottom. That can be a cause. Pancreatic cancer, which is up here as a growth in the pancreas, and splenic artery emboli are said to cause pancreatitis as well. So that's a pretty comprehensive list of all the potential causes summarised here diagrammatically for you, and I would hope that you feel that you can take this diagram and have it in your mind's eye the next time anyone asks you or you need to know about pancreatitis. You can refer to this in your mind's eye and recall all the potential causes for it.